Good morning, ma. Previously, we have discussed about the in pediatrics ortho disorders of the in the children. Now, today let us discuss about the clubfoot. Actually, you all know what is clubfoot. It is the disability which is congenital in the foot of the newborn, and usually it is described as it is a range of foot abnormality usually present at birth, that is congenital, and the foot is usually twisted out of shape or position. Here, in clubfoot, the tissues connecting the muscles to the bone are shorter than usual, and it is fairly common birth defect, and usually it can be corrected as a healthy newborn also. And this clubfoot can be mild or severe, and about half of the children with clubfoot have it in both the feet. If the child has clubfoot, it may make it harder to walk normally, and that means the child cannot walk normally, and the running, walking, and there is a difference in the gait also. And here the doctors usually able to treat the clubfoot. Usually without surgery also most of the cases are successful. Coming to the risk factors, usually boys are more at risk than the girls. That is twice boys are at risk. And coming to the family history, usually both the parents having clubfoot means the child is usually with the clubfoot. And the congenital conditions usually associated with the skeletal abnormalities also will have clubfoot, like a spina bifida. And environmental factors like smoking and alcohol, they also lead for the clubfoot. And when there is less amniotic fluid during the pregnancy, that time also the baby is unable to move properly freely in the womb, so that's why the baby may have the clubfoot. And if the child is having clubfoot, how it looks like? Usually the top of the foot is usually twisted down and inward, and in the arch is increased, and the heel will be turned inward. The foot may be turned so severely and it can look as an abnormality. The affected leg or foot may be slightly shorter than the another one. The calf muscles are affected also will be underdeveloped. That means the development will be delayed, and usually it looks as discomfort, and there is no discomfort and pain usually for the child, but it looks like odd for the child. And how the clubfoot is diagnosed? Many times the diagnosis is usually prenatal only, before delivery only, when we are having scannings, ultrasound scans we have, no, during the antenatal checkups, at that time only we can detect the baby is having the clubfoot, but we cannot treat before delivery. That means before the child comes into the world, we cannot treat. When you after the we are seeing the child and we are touching the child, then only we can treat the clubfoot. Coming to the treatment, in the past, usually after several decades and in the last century, usually the treatments started as non-operative treatments, that is without surgical procedures. Before there were surgical procedures, in the last century only they have started the casting and bracing, that is applying some bandages and pressure bandages and some instruments without performing surgery. They are treating the bones in the newborn. Usually they are very cartilaginous and they can be molded easily and they can be manipulated, so casting is very good method to treat. And this set of long leg cast requires weekly visits to the orthopedic center to change the foot position in orderly method. Usually slowly they'll change the cast in so and so weeks, for 4 weeks, for 8 weeks, for 10 weeks, like that. Slowly, week by week, they will be changing the position, and slowly it will come into the normal position. And there are typically 3 to 6 casts required to complete the process. Infants will need the sponge bathed during the sponge bath during this period, and the process usually transmitted in car seaters. And usually if the infant is hungry, they can be bottle fed at this time, and they can use some snacks and toys usually to cooperate for the procedure. And usually the baby should be dressed with a bulky cloths, and the bed should be very thick. And usually if not treated properly, some of the complications we can see, like arthritis and poor self image and inability to walk normally, and problems stemming from walking adjustments we can see, that is awkward gait can be seen. And usually after this uh, casting and dressing, it can be repeated percutaneous tall by the percutaneous tall, and smaller percentage will require a small tendon transfer to correct a mild rotation. And a child with a severe or rigid club foot may require more extensive surgery, and this will be discussed soon. Coming to the surgical treatment, usually 80 to 90% patients will require a surgical procedure that is known as percutaneous transverse HLS lengthening, and some patients perform this under the local anesthesia, and some others by the nationwide they perform under the general anesthesia, because under general anesthesia means the baby will be calm and quiet, and they will be stable, and it is easy to perform for the doctors. And some physicians usually they give general anesthesia, and it is usually the procedure will be for only 15 minutes, and a small nick will be made in the skin, and it is very tiny scar, and it can be healed thoroughly, and the scar will be become later invisible also. And the tendon is found, and a small cut is made through the tendon to allow to stretch and lengthen. By lengthening the heel cord, the heel is able to drop down and for the normal standing position. After this procedure, usually the infant will be placed back into the cast for 2 to 3 weeks before transitioning into the special shoes and brace. With time, 10 to 30% of children will require repeated turn, and smaller percentage will require small tendon transfer to correct the mild rotation. Even after the surgery also, if some of the children will not get corrected properly, that time a small tendon replacement will be done to correct the posture. Rarely a child with severe or rigid club foot will require more extensive surgery, and this will be discussed. And at this time the baby should have extra diapers and wipes, as as the plaster can adhere to the diaper and skin can be applied the cast. And 80 to 90% of the patients with club foot will be treated with Ponseti technique, and and some of them need a small surgery, and 10 to 20% of patients will require reconstructive foot surgery when the child is 1 to 2 years old. This number can be high as 40 to 50% if the shoes and bars are not used for full 4 years after casting. That means after treatment also, after surgery also, the shoes should be used for 4 to 5 years in order to heal properly. Coming to the complications, usually there are certain complications if, after the surgery and after casting also. They are the problems starts when the baby walks and stands. Usually there are movement problems, leg lengthening problems, and shoe size will be altered. One which is affected, that shoe size will be 1.5 to 2 centimeters less than the unaffected leg, and movement problems will be less flexible, and length of the leg also will be less than the unaffected length, and calf size of calf muscles also will grow less on the affected side. Coming to the prevention, the doctors know what are the we cannot identify the cause, exact cause of the club foot, even though we can prevent some of the complications like smoking, alcohol, reducing the work for the pregnant women. Like this, we have to suggest, and the drugs which are not advised by the doctor should not be taken. Thank you, ma. Hope you all understood the topic. We'll continue.